So our next topic is all about Republic Act 8423 or the Traditional and Alternative Medicine Act. The Republic Act 8423 or the Traditional and Alternative Medicine Act of 1997 provides for improvement of quality and delivery of healthcare services in the country through the development of traditional and alternative healthcare and its integration into the national healthcare system. So, we know that the Republic Act 8423, known as the Traditional and Alternative Medicine Act of 1997. So, is a Philippines law aimed at enhancing healthcare quality and accessibility by incorporating traditional and alternative medicine into the country healthcare system. This law established framework for the recognition, development, and promotion of the traditional and alternative medicine practices, ensuring they are safely and effectively integrated into the mainstream healthcare. Now, I have a key points that you will enlighten you more about this Republic Act 8423. So, number one, we have the promotions of traditional and alternatives medicine. So, TAMA recognizes and value of traditional healing practices like herbal medicine, acupuncture, and massage therapy, and encourage their safe and scientifically valid use. So, it promotes these practices as complementary to conventional medicine, especially the rural or the underserved areas. Number two, we have the establish of the Philippine Institute of Traditional and Alternative Healthcare. So this law creates the PITAC or the PITAHC as the lead agency responsible for the research, regulations, and the integrations of alternative medicine practices. So the PITAHC or conducts studies on the safety and efficacy of alternative treatments, registers practitioners, and helps set standards for traditional and alternative health products. Number three, we have the research and development. So this supports scientific research to validate the traditional and alternative treatments. So this includes conducting studies on medical plants or indigenous healing practices with the goal of providing evidence-based support for these practices. Number four, we have the access to affordable healthcare. So, by promoting traditional and alternative options, TAMA aims to expand it to affordable healthcare, especially in remote communities. So, the law recognizes that these practices are often more accessible and cost-effective, providing option for people who may not have easy access to hospital or doctors. And number five, regulations and quality. So TAMA enforces quality standards for traditional and alternative treatments to protect public health. So it ensures that practitioners are licensed, that products are safe, and that treatments are administered by qualified professionals. And number six, cultural prevention. So this law also serves to preserve indigenous knowledge of traditional medicine, which is an important part of Filipino cultures and heritage. So by officially recognizing these practices, TAMA helps protect, promote the cultural knowledge of local communities. So through Republic Act 8423, the Philippine takes a holistic approach to healthcare, blending conventional, traditional, and alternative medicine to create a more inclusive and comprehensive national system. Now next is the policy also identifies medicinal plants in the country which are readily available. These medical plants shall be given care by different agencies. So in order to coordinate various activities and programs in the traditional and alternative healthcare delivery system, the Act provision the establish of the Philippine Institute of Traditional and Alternative Healthcare, or the PITAHC, to accelerate the development of the said healthcare in the country. Now, the under of the Republic Act 8423 of the Traditional and Alternative Medicine Act of 1997, the Philippine government takes a proactive stance in identifying and supporting the use of medicinal plants so that are locally abundant and accessible. So the Act of mandates various agencies to protect, manage this valuable plant resources, ensuring that they are cultivated and sustainably used for the benefit of public health. So, number one, identification and protection of the medicinal plants. So, the Act specifically identifies medicinal plants across the Philippines that are beneficial for traditional and alternative healthcare. Two is it calls the protection and careful management of these plants by different government agencies, recognizing their importance as a natural cost effect of resources healthcare. Next, we have the coordination through the PITAHC. So, TAMA established the Philippine Institute of Traditional and Alternative Healthcare. So, an organizations tasked with coordinating all activities related to traditional and alternative medicine. Next is PITAHC role includes overseeing research, product development, educations, and regulations of traditional and alternative healthcare, practice and medical plans. And by centralizing efforts under the Philippine Institute of Traditional and Alternative Healthcare, the government aims to accelerate the development of alternative healthcare practices and ensure that they are safely integrated into the national healthcare system. So next is we have the research and development of medicinal plants. So PITAHC is responsible for promoting scientific research on medicinal plants and validate their effectiveness, safety, and potential applications in healthcare. So this research supports the evidence-based practices that can increase the acceptance and use of traditional remedies, ensuring they meet quality and safety standards. And lastly, we have the integration and accessibility. So by supporting the cultivation and development of medicinal plants, TAMA helps make alternative healthcare more accessible and affordable for Filipinos. So these plants can serve a reliable resource, especially for communities with limited access to conventional healthcare services. So the Republic Act 8423 and the establishment of PITAHC underscore the government commitment to developing and integrating traditional and alternative medicine into the national healthcare framework. The policy ensures that valuable medicinal plants are protected and studied while also supporting healthcare practices that can cater to the diverse needs of the Filipino populations.